As news of the deadly school shooting makes its way across the nation tonight, you may be wondering how to talk to your kids about the situation.
So KREM 2's Laura Papetti talked with one mental health professional, and here's some of what she had to say.
It comes up in conversation in the newsroom, and so many of us think, how am I going to talk to our kids about this? And we know we have people at home wondering, how are they going to talk to their kids about what happened in Texas? So my first question is, how do you start that discussion with kids, and should you bring it up?
Yeah, I think we're all just heartbroken and frustrated that we do have to have these conversations with our kids. I think the thing to remember is that you are your child's greatest safety signal. So it is important to talk to them. And in talking with them, what you're telling them is they are safe to talk about things with you. And because you are their primary source of safety, you're reinforcing to their hearts and minds that they can talk about these things and they are safe. And so I would say, yes, it is important. I think it's also important to remember, though, that you want to make it appropriate. So for younger children, you want to talk briefly about it. The older the child, the more they're probably going to want to go more in depth.
Do you let them ask you questions? Do you tell them some bare facts about it and then say, what would you like to know?
Yeah. What are you thinking about this? I think that's the question. We want to find out from kids, what are their thoughts around it? You know, sometimes they've got accurate things they're thinking, but sometimes they might not. So asking them, what are you thinking about when you hear this? What are your feelings about that? That allows us to get an idea of what's going on in their brains around the subject.
Do I turn off the news? Do I say no social media? What do I do to help control what they're getting?
You know, your younger children, elementary age, I would say really limit the amount of media. We can talk about it. We can kind of give it a container. We talk about it a little bit. We're going to set it aside, and then we're going to go play, or we're going to do some engaging, fun, pleasurable activities. The older a child, the more they may have questions and the more time you may need to spend with them. Again, making sure that you take time to have just that space that they can ask questions, they can process with you. That is their greatest signal of safety.
At what point do we think something is wrong? Or what should we be aware of in terms of their actions that make us think, okay, this is affecting them more than we thought?
Sure. So it won't be unusual for maybe a week. You'll see a child be a bit more agitated. You'll see they may be a little bit more sensitive. That's actually really normal. So continuing to be available, I think being available and just offering to be there to talk without obsessing about talking, I think is the key. So finding that balance. If you notice after about a week that they're starting to withdraw, they don't seem to be engaging in pleasurable things, hanging out with friends, I think that's when you may want to check in with your child again and just ask them, what's going on? You know, are you thinking about something? Are you having feelings about something? And if after a period of several weeks you notice your child really beginning to withdraw or disengage, or the opposite, becoming extremely volatile, that may be an indicator that working with a mental health professional could be really helpful.
Some good information from right there. By the way, you can find that entire conversation on the KREM 2 YouTube page. We'll be right back.